Hello and welcome to all of our Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And today I have a special guest here with me. It's Rebecca Feldman. Hi, Rebecca.
Hi, so good to see you. Thanks for having me.
It's wonderful to have you here. Rebecca, you are, of course, a speaker at our GOLD Midwifery Online Conference that's just coming up just around the corner in February here. And you will be presenting on a very important topic titled Decision-Making and Psychiatric Medications in Pregnancy and Lactation. Want to go into that in just a little while. But first of all, I want to talk about your background. You are a midwife and a psychiatric nurse practitioner. I want to clone you. I think we need some of you in each and every
Oh, thank
location
you.
for consultation. You would be like amazing to have you close by. So tell us a little bit about your work, your background, and how did it come that you are in this dual role that you chose to be?
Sure. So I became a nurse about 20 years ago, and I was torn between working in labor and delivery and psychiatry because in my training, I loved both, but I knew I wanted to be a midwife, but I was always had this special interest in mental health and also always noticing how hard it was for people to find specialized treatment for people who really knew pregnancy as well as mental health. And I worked in labor and delivery, and then I worked as a midwife for 10 years in city hospitals here in New York City, where I live. And I became obsessed with mental health in pregnancy because I was always looking for providers for my patients. And it was a one-day decision where I had referred someone, and I realized that I knew more about the medication in pregnancy than most of the people I was able to refer to. And so I just decided going back to school. And it's been great. And there's actually, so I'm a psychiatric nurse practitioner and also a therapist. I love group therapy. So I run a lot of groups for moms, for dads, for partners. And my group practice now, there's 5 psychiatric nurse practitioners that work with me, and 2 of us are nurse midwives as well as nurse practitioners. And Holly, who works with me, she was a midwife for 20 years, and we had a very similar path of getting to this point. But when you mentioned cloning us, it is starting to happen that more people are becoming interested in working in this dual role.
That's fantastic. I'm so glad to hear this. And you're filling such a need there, as you mentioned, that was born out of, you knew more than the people you refer to. And, and it's so important. Mood and anxiety disorders in pregnancy and postpartum. We have been talking more about this in recent years. There has been more light been shined at this topic, and the stigma, it feels like it's going down a little also as, celebrities are disclosing that they had mood or anxiety disorders, either postpartum or during pregnancy. So that's already good, because the more people see this, they know, it's okay to disclose it and work with it and seek help and such. But we still see there is still stigma, and clients often are also worried to disclose it, right? Either because they're worried that it can't have the birth they envision, maybe in a birth center or in a different setting, or they are worried that maybe a Department of Family and Children comes in and maybe takes a baby away. There's plenty of reasons why clients don't want to disclose it, or so what have you seen? What kind of advice can you give us here?
Well, I have found stigma is something we talk about all the time in my practice, of course, and as a midwife, absolutely, because I was part of a big initiative to do screening in New York City. And as you're saying, so many people were afraid to really say how they're feeling.
Yeah.
We've found that one of the best ways to reduce the stigma is providing group care. So we invite everyone who inquires about our services to attend a support group. So we have free support groups, and then people start the conversation. They'll start to talk about some of the hardest things that they're going through, some of the scariest thoughts that they're having. And there's always this moment where people say, oh, it's not just me. I'm not alone here. We also do medication management in groups. So Holly and I, she's the other midwife on my team, it's modeled after centering pregnancy, which so many
Oh, I love
people
that.
from GOLD will be familiar with. So we
Yes.
do the mental health management of medication in a group. So some people, sometimes it's for cost because it's lower fee, but what we hear over and over again is I just love meeting other moms who are taking medication while they're pregnant or lactating or planning pregnancy. So we meet in groups of 5 to 6, sometimes a little bit bigger. So that's one thing that I've found to be really helpful, and just talking about it all the time. And as like you're right, the celebrities have really helped because now people are hearing more about it.
Absolutely. I love the group setting that you mentioned. And also for medication, I have not heard that before, yeah, of course, centered, our for midwifery. Yes. And absolutely adore it and love it. And it's a great way to practice. But I had not heard about this. This makes so much sense though,
Yeah.
feeling, you're not alone. You're in this group. You're lovingly taken care of, and you have the support group that is there for you. So if for any people in New York City, where can they find you? Just, do you have a website or anything where they
Yes,
can?
absolutely. So our website is brooklynparentsupport.com, and Instagram, we're Brooklyn_parent_support. That's on Instagram. And yes, anyone who's looking for support groups, we have several free groups. The specialized groups that we have we have a new LGBTQ parents group starting.
Fantastic.
And 2 of the MPs who work with us run a Black and Latinx support group. And then we have some closed groups, but we also offer individual and medication management. So yes, please stay in touch, anyone who's listening.
Yes, absolutely. Great work there. Great practice. Now let's talk about the presentation here for GOLD. You are talking about decision-making and psychiatric medications in pregnancy and lactation. I'm so glad you're presenting on it, because I feel still, with all our knowledge, there is still a lot of misinformation around, even amongst healthcare providers, right? Often women are even told, oh, if you're on that medication, you can't breastfeed if you're on that meds. You better not even attempt it. Or also during pregnancy, it is very scary for many parents, being in this situation. So tell us a little bit about that, what we can learn here from you.
Yes. So it's an hour-long presentation that I'll be giving, and there's some case studies that the participants will be able to review beforehand, so we can really get into some of the ins and outs of decision-making. And I'm mostly from the midwifery perspective for people who maybe doing the initial medication decision and referrals, and how to work with the patients who are presenting, sometimes with complex mental health conditions and histories. Very excited. And the reason that I wanted to focus on the decision-making piece is because I'd love to turn the equation around to, can we use this medication in pregnancy, to more, what does this person need to feel well while they're pregnant? Because so often that's the question that I get for consultation questions is, do you use this medication in pregnancy? And it completely depends on what that individual needs, which I think is very hallmark to how we provide midwifery care. So I think it's a good fit for GOLD Midwifery.
Fantastic. I can't wait for this presentation and to learn from you and participate in the case studies. I think these case discussions that you are bringing up, I think that is so valuable and a great way of learning, because we all feel like we're part of the solution seeking here. So
Absolutely.
that's fantastic.
Good. Thank you.
Well, thank you so much, Rebecca Feldman, for sitting down here with me, talking about the amazing work you're doing in your community there in New York City, and providing all the resources, and coming here to go to share your knowledge and wisdom about the topic here. Thank you so much.
Thank you, Kristen. I really appreciate it.
And for our viewers now, if you found this topic interesting and also want to learn more about this, we invite you to go to goldmidwifery.com. There you will find all the information about all the presentations of the conference. We also have our open access keynote presentation on shoulder dystocia coming on February 6th. So I hope you sign up for that one as well. Share that with your friends and colleagues in the field. And we hope to see you all at the conference. Bye-bye, everyone.